Good morning, everybody, and welcome back to the second session of our 2021 Digital Virtual Health Series here in April. This conversation is all about how the role of the CIO is changing, and boy, do we have an all-star lineup of speakers. Before I introduce them, I just have a couple of quick housekeeping announcements to make. First and foremost, I want to thank Aruba as well as Kairos for supporting this particular session. Without your support, it would not be possible. So thank you all very much. And I also wanted to remind everyone that you can ask questions two ways when we're in the sessions. You can use the raise hand button at the bottom of the screen, and that will allow us to call on you and unmute your mic, and you can ask your question live. I really hope that somebody asks a live question today because it's really cool when it happens. So I encourage you all to think about a question you want to ask live. You can also enter a question into the Q&A box, and we'll get to that as well during the Q&A portion of the program, or answer it along the way if we can. So those are two ways to ask questions. Again, you can use the raise hand function to ask a question live, or you can drop your question in the Q&A box. I wanted to have a brief discussion, and not brief discussion, but a brief shout out or important announcement. In the next conversation that we're having at the end of the day about leading the IT workforce of the future, we're going to be covering diversity, equity, inclusion. And I also wanted to point out that despite the looks of today's panel lineup, Healthcare Innovation is extremely committed to diversity, equity, and inclusion efforts. You know, we were planning these panels today. We sent out a bunch of invitations, got really excited, and all these people responded back saying they could participate, and we were all excited that they could all be here because they really are experts in their fields. And then we realized we had 3 panels of men, which is something that we don't do typically. So I thank you guys for your grace and your patience with today. Encourage you to take a look back at some of our other panels and look at some of the other panels coming up where we have a more diverse lineup. That's not to discount any of the speakers that we have today because they're all wonderful, but I just wanted to point that out because on the outside, it looks like we have all manels, as they call them, but that was not intentional and just happened by mistake. And that's something that we take very seriously around here. So with that, I am going to flip it over to our panelists and get them introduced. First up, we have Dr. Chris Longhurst, who's the Chief Information Officer and Associate Chief Medical Officer at UC San Diego Health. Welcome, Chris. We also have Tim Zoff, a strategist, and I believe he's a recovering CIO, as I like to joke. He's with Impact Advisors. We have Chris Gervais, who is the Chief Technology Officer and Chief Security Officer with Kairos. We have David Logan, who's the Vice President of the CTO Office at Aruba, a Hewlett-Packard Enterprise company. And of course, Sue Shade, Interim Senior Vice President and Chief Information Officer at Boston Children's Hospital. She's also a principal of Starbridge Advisors and CIO extraordinaire within our community. So Sue, thank you for joining us. We really appreciate it. With that, I'm going to turn it over to Mark. Mark will take it away and lead the panel discussion. I'll see you guys during the Q&A portion.
Thank you so much, Stephen. Thank you for all of you. Thank you to all of you in our audience who are still with us today. We really appreciate it. I am so excited to have this panel of luminaries from our field, really. They're all people who have been around a while. I won't say too long a time because that makes us sound old, who have been very experienced in our field and are known as true leaders. So what I'm first going to do before we plunge in, I'm going to ask each panelist, I'm going to go clockwise in my, we're living in this Brady Bunch world where we're all in little boxes now. So I'm going to go clockwise from the upper left and just ask each person to spend 1 minute. We know their title, but tell us a little bit about your connection to this topic of leadership and the CIO 2.0. And I'm going to begin with Sue Shade. Sue, welcome.
Thank you, Mark. Good to see all of you. Glad to be here. So I have over 35 years in health IT management, so I guess there's some credentials there. Working at the CIO level, starting in 2000 when I was CIO at Brigham and Women's Hospital in Boston for nearly 13 years. I left there, went to University of Michigan Health System, was there for a few years, and then went down the path of doing interim management, consulting, and leadership coaching, and started a new firm called Starbridge Advisors. And that's what we do. We're a health IT advisory firm. Interim management is one of our core businesses. And I have had the opportunity to do a couple interims since we started it in 2016. Most recently and current is at Boston Children's Hospital. I've been there now, this is week 7, and excellent organization to be part of.
Wonderful. Thank you so much, Sue. Chris Longhurst, Dr. Chris Longhurst, welcome.
Thanks, Mark. It's great to be here. Appreciate the opportunity to share some lessons learned here. I do not have 35 years. I think I've been in the field about 20. But prior to joining, I did a graduate program in health informatics during medical school. So this was a career I knew that I was interested in pursuing. And after finishing my training in pediatrics at Stanford, I joined the faculty there, where I eventually helped to implement 2 different electronic health records and became the chief medical information officer. And under the tutelage and mentorship of Ed Kopetsky and Lisa Grissom and other great leaders there, developed a larger administrative skill set, and joined UC San Diego over 5 years ago as the chief information officer, and then subsequently took on a role helping to lead quality and patient safety as well.
Thank you so much.
Terrific. Look forward to the conversation today.
Thank you so much. Really appreciate it. Tim Zoff.
Yes, good morning, everyone. So Tim Zoff, like Sue, I have over 30 years of healthcare leadership and CIO experience, really 20 of those years as a Senior Vice President CIO at Northwestern Medicine. Really for the last 5 years, working in strategy and digital health, both in health delivery, but life sciences, as well as advising technology companies. And like Sue, I also do CIO coaching. So Mark, a topic that's near and dear to my heart, just like yours, to talk about this evolving role of the CIO.
Thank you. Thank you so much, Tim. Chris Gervais.
Great. Thanks, Mark. So I'm Chris Gervais. I currently serve as the CTO at Kairos. And one of my biggest connections here is that I get to work with a lot of CIOs who are navigating the changing landscape of digital channels, enablement, patient access, and thinking about their role and executing on their role as really solution architects now. And a lot of that experience of what they're facing, I actually got a long time ago. It seems like a long time ago now, when I actually had the opportunity to work with Sue at Partners Healthcare in Boston, where was able to work closely with the CIOs at Partner, as well as the clinical and informatics staff, as that organization was growing and adopting more and more technology in service of improving care. So got to see really from the inside how the role of the CIO, even at that point in time, was changing considerably, and now how it's changed even more. So really looking forward to the conversation today.
Thanks so much, Chris. David Logan.
Thanks, Mark. Hope everybody's doing well today. Glad to be here. It's a beautiful day in North Carolina. Hope it's beautiful where you are too. Similar to Tim and Sue, I've been in the IT industry for over 30 years, predominantly in the vendor space. I started my career in IT in healthcare, helping build some of the first client-server network architectures at Duke University and Durham Regional Hospital, and then was called into the vendor community because I'm ultimately I'm a builder. I'm a builder of products. I'm a builder of solutions, and I've been able to enjoy a career since joining the vendor community in the early 90s of focusing on healthcare, helping, for example, build one of the first network-based PACS implementations at Duke University and Duke University Medical Center. And then over that time, focused on networking, security, data communications, data center architectures, and ultimately really helping build systems and technologies that can be used to create very diverse, engaging environments for how applications flow in healthcare organizations, who those constituents are, how are they satisfied. And so being in the middle in the vendor space of the organizations that need to consume technology and the users, the practitioners, the benefactors of that technology, it truly has been rewarding and has led to every year being something different, every 2 years, every 5 years being something different. That really caters to me personally, which is really why I love this space. And so I'm pleased to be with so many other experienced team members today.
Thank you so much, David. That was great. And I'm just thrilled to be with this group of people. You all have so much experience in the field and so much to share. And I've been fortunate in my career. I've been in healthcare publishing for 32 years now, and leadership has always been of interest to me. I remember from the very first wondering, well, why is it that some patient care organizations are doing better than others. And ultimately, it comes down to leadership. I mean, it comes down to people. And when you look at patient care organization A, that's doing stupendously well along all dimensions, and patient organization B that isn't doing so well, once you start peeling away the layers, it actually comes down to people. So, so this topic is very much close to my heart and to my mind. So let's start. What I'm going to do, I actually have a whole bunch of questions for you all. So we're going to try to be efficient, time efficient, and yet let everyone speak. So some of the questions will be directed initially at one panelist, and then of course everyone will be able to respond. And other questions I'll just throw out to the whole group. And the first question is of that latter category. I first want to ask you, because it's affected all of us, the COVID-19 pandemic. I know you've heard of it. I describe it as this thing that crashed into the earth. And, you know, it's literally affected now every person living on the planet practically. And it certainly has impacted healthcare organizations. So how has the pandemic impacted the day-to-day landscape, operational and strategic landscape for CIOs? And I think we all know that initially there was just this massive set of adjustments that had to be made. We had to make as much care delivery remote as possible, as quickly as possible. We also had to move staff, employees, affiliates off campus as quickly as possible, all to minimize potential of infection, et cetera. So, and then we had to adjust a little bit later because we realized that by just like throwing people onto certain platforms that weren't secure, and we knew that we just had to do it very quickly, things had to be securitized. So whoever would like to leap in first, what has been the overall impact for CIO leadership and management of the impacts of the pandemic?
I'd love to hear Chris Longhurst start on this one because he lived it.
Yes,
I was just going to
absolutely.
say the same thing to you, Sue.
I didn't live it in the same way. But do you want me to go first?
I'm happy to speak a bit. So, Mark, great question. I mean, I think the first thing that we all recognized is that information technology and health informatics was crucial to our COVID response at hospitals, health systems, and at the public health level. And data management and good data management really enabled better response.
Yeah.
So there's no secret that the role of the CIO became more prominent in the COVID pandemic as we, as you noted, sent much of our workforce to work remotely, launched telehealth at a level that was really unprecedented, built COVID analytics dashboards and new workflows in electronic health records. And in some organizations did things like deployed electronic PPE using secure messaging, other ways to decrease the need for entering COVID patients' rooms when not necessary, deployed artificial intelligence solutions to help with diagnosis and other things. But I wouldn't say it's fundamentally changed the role of the CIO. I think that while it's been more visible, it's really built on a number of principles that have been around for many years. And as I mentioned, I've had terrific mentors, both clinical and non-clinical, in the leadership arena. And a lot of this came down to things like good governance, good preparation. One of the reasons that UC San Diego Health was able to deploy telehealth so rapidly that we actually, did more video visits in our first 3 days of the federal declaration of the pandemic than we had done in the prior 3 years, was because we had laid that infrastructure. Our telemedicine executive committee had made those investments. We had the technology ready. We had the training materials ready. And it was really a matter of operationalizing it. Likewise, we deployed an AI solution to help with diagnosing COVID on chest x-rays. And this was long before, ubiquitous prevalence of COVID testing. And I remember we met on Friday, March 13th with a radiologist and some technicians who had this algorithm ready based off of running machine learning on a data set from Wuhan. And 2 weeks later, on Friday, March 24th, we had this live in production. And we ran it on 60,000 chest x-rays over the next 90 days. So every single chest x-ray that was done at our organization. The reason that we were able to do that so quickly was because of the ability to focus, right? So we did not have other priorities when this pandemic started besides COVID. And so we were able to deploy all those resources in a really effective way. But again, these are built on leadership principles. So one of the things that really supported us very, very well through the pandemic was our journey towards lean management at UC San Diego. So we have a series of tiered daily huddles, what Lean calls a daily management system. And those tiered huddles helped with communication up and down the organization in a very rapid manner. It helped with escalation, helped us to deal in an empathetic way with problems from medical staff issues to patient care issues to information technology issues. So that, for example, on January 6th, when my CEO and I had a call with our county public health leaders about deploying the first vaccine superstation in the state of California, 5 days later, on Monday, January 11th, we opened that first vaccine superstation, and we're delivering 3,000 shots a day on the first day, and by day 14, 5,000 shots a day. And I really credit the organizational structure for enabling that, because there were 9 different work streams, of which information technology was only one that had to come together to make that happen. So I guess I would really summarize by saying that I don't think that this is a new skill set. I think it's more prominent, more visible. And this was really an opportunity for leaders in information technology, as well as other aspects of healthcare organizations, to step forward and make a real difference.
I think that's absolutely right, Chris. And I also think many CIOs have told me it showed everyone that organizations can move fast if they need to. You know, that's one of the urban myths in healthcare, that you can't. Sue, I know you have thoughts on the tip of your tongue.
Well, I do, and this is why we wanted Chris to go first, because he lived it. I didn't live it in that way. I've come in now at this stage of it into this role, and I actually finished up a interim role in February 2020, just before I did my handoff to someone else. And I remember the management meeting we had in IT that on my last day, I don't know, 3rd week of February. And one of the leaders said, should we be thinking about COVID? No, it was coronavirus then. Should we be thinking about it? And it was still early. But as we know, it all changed pretty quickly. I just want to pick up some broad themes from what Chris said, if I may. You know, I hear from CIOs about COVID speed. And you were just alluding to it, Mark, that pace, that ability to get things done quickly. And, you know, it's probably a double-edged sword now, because it's like, what are the expectations? If you could do stuff in hours versus days, and days versus weeks, what's expected? But, you know, some of the positive takeaways from this terrible year, focus, the difference that focus makes. When you take away all those other distractions and priorities, this is the focus. Also, decision-making. How many of us in organizations have been to a gazillion meetings where we can't make a decision, we work towards consensus? In this situation, decisions were made quickly. And money, budgets. You know, Chris, you probably had many times where you said, I got to do this, and someone said, do it. Don't, you know, tell me what it's going to cost later. So what of those positives do we take away for the go forward, I think, is one of the questions. I would also emphasize what I'm hearing from people is that as we come through this pandemic, we're in this phase with the vaccines and you know, going back to some new normals. A lot of the projects that were put on hold for IT are now just being added on top, and there's just this additive piece. Right. And I think that at this point in time, governance is more critical than ever, because you have to go back to what were the focus, fewer priorities, how much can really be accomplished at any given time.
Yeah, I totally agree with you, Sue. One thing that you said, I'd like to just touch on. It's true that we all proved that we can move quickly if we need to, and now everyone's expecting that. So yes, it did kind of create new expectations. Anyone else before we leap onto, I see Tim, you're about to.
Yeah, Mark, I would just offer just a piggyback on this, I do think, and one expression I like out of what we've learned is sort of what we've done out of necessity, we'll continue to do it because it's logical. And I think the notion here is that we picked up the pace, and actually, not only in doing so, we've empowered others to lead. So back to this notion of agility, I think we've discovered a new way to engage the business on how it delivers. And we've taken out a lot of structure, and we've leaned out decision-making, as Chris talked about it. So I had an opportunity to work in life sciences this last 6 months. So they also had the same pace and expectation. So I think we've kind of learned that IT really needs to be this co-participant, and that leaders really need to be exceptional at communication skills and not just the mastering of the technology anymore. So we were really, field forward in delivering on this and engaging and empowering others. And I think those attitudes and that expectation of pace will continue.
Right. And if I can, let me leap forward, because that segues into my next question. We're having such a great discussion. We'll never even get to question 4, though, if we if we stay at this wonderful depth. So let me just leap ahead a little bit. What you just said, Tim, helps me segue perfectly. So the very concept of what a CIO is and does, we all know has evolved tremendously over the years. And some of us have been there for the whole of evolution. And as I like to say, if it makes you feel old, then just tell people you started in the womb. But so one of the things that we know is that initially, the first CIOs were IT directors, right? And many of them came from programming, et cetera. We know now that where the CIO must go is to really be a strategic leader in their organization. And the way that some have phrased it to me is that huge shift, that heavy lift going from being quote unquote an order taker, which we all dislike that formulation, but for shorthand, to being a true strategic leader who can sit at the table, at the C-suite table with all the other O's, and say, they'll turn to the person and say, Jane or Joe, well, what do you think? And Jane or Joe will be ready because they're not only on top of the technology, but they also understand the business objectives of the organization. They understand where the industry is going and things like that. So let me start with Chris or with Tim, actually, and then we'll go to everybody else, about that evolution and how you see. You lived it yourself. You went through it yourself while you were a CIO. Where are we on this journey into 2.0-ness from your perspective?
And I think that, and again, my colleagues can comment on this, but I always say one of my other expressions is, technology moves very fast and organizations move very slow, and there's consequences if you let that happen. So I think CIOs are building a new partnership with the business. That is, they're building not only the business literacy of their teams, but the digital and technology literacy of their executive teams, because you can't afford to have white space anymore between strategy and technology. It's almost a co-creation. And so you really have to allow the strategy to shape the technology to shape the strategy, and strategy to shape the technology. So I think there's a higher expectation around CIOs for their real participation with CEOs and strategy officers. It feels very much like co-creation. And I think the other expectation of CIOs is they actually participate in the change. That is, it's really important they demonstrate, they understand the consequences of what it is they're offering and doing. And actually that creates confidence in the leadership team if they actually are not only delivering on the technology, but participate in the change and really understand what this means for the business, given how important it is to get it right now in this period of transformational change, and how really technology is almost a survival strategy for organizations going forward. So I feel like, Mark, I've seen the roles continually be elevated, but now you've really got to be that leadership, strategy, confidence building, sustain the trust in the organization in order to really be the 2.0 leader.
Absolutely. Everyone else, leap in.
To amplify what Tim was saying, our focus when we're engaged with CIOs and broad healthcare organizations is to help understand the experiences that need to be delivered and who the constituents are that need those experiences. And if you think about it, we've dramatically shifted who we care about that has these experiences and how they need to be delivered and who's responsible for defining them. So much so that we've moved from a highly centralized model where, in the case of digital experiences, IT and the CIO is responsible for all possible digital experiences inside a given organization. And now patients, providers, service providers, vendors are all defining the experiences that will be delivered digitally. And so now the role of the CIO is one of recognizing and embracing that condition, understanding how a set of infrastructure and policies and systems can be put into place that then embraces all of those different constituents' ability to contribute and take advantage of all of those systems, while at the same time not causing additional risk, dramatically inflating cost. It's a balancing act. It's both interesting and very difficult.
David, that's a great point. And I think another area that, from my seat where I've seen working with leaders like those that are here today is, along with just the changing leadership challenges, is this perspective change, right? That you hinted at, Tim articulated around looking at solutions through the lens of portfolio management, right? In the sense that there's a broad array of things that we could do. We have our own, we've got partners, we've got whatever. And it's the composition and the ability to compose that portfolio for the business need, not just quickly, but certainly, cost effectively, and almost taking that like, you're like an investor, right? You've got different assets, you've got to manage them, you've got to get a return on them. And just seeing some of the different ways that our customers have operated and what they've indexed on, not just during this time, but what they hope to bring forward has been, not only has it been cool to see and be a part of, but it has been great to see that type of business orientation just become so primary that, the secondary stuff about how the tech works, what's going to put together, like that can get easily solved. And some of the CIOs that we've worked with have actually changed their teams dramatically over the last year. They're bringing in other types of folks on their team that maybe wouldn't have normally been on a CIO's team, that are thinking more and helping them execute in these ways. And I hope we see that momentum continue, even as we're in our new normal, because that's where I think that this role will continue to lead breakthrough innovations for health systems.
Yeah, and we'll actually be talking about that in a few minutes, a little bit more in depth. But Chris Longhurst, you are so interesting, not only because you're an interesting person, but also you are among the few MD CIOs who actually, even in medical school, you were thinking about this. You were thinking about clinical informatics, and you were thinking about how that ties into general informatics and into medicine. A lot of times now we're getting people with MD and RN backgrounds, which is wonderful, in the position, but they may not really have had that broad exposure to not only information systems, but processes in organizations. Where does that lead us, leave us right now in this moment as we need 2.0 type CIOs?
That's a good and tough question, Mark. So first of all, I just want to add that I've had terrific mentors and colleagues who are not clinician CIOs, and I don't think that that's going to become a requirement of the position. So that being said, I do want to shout out also to some of the physician CIOs like Dr. Landman at Brigham and Women's, and Dr. Nygren, who's now at Maine Health, and others who've been, role models for me. I think each of us will bring different strengths and weaknesses to leadership roles. For me in medical school, I remember on my pediatrics rotation attending a delivery where I was going to be responsible for helping to resuscitate the baby. And afterwards, we sat down to write the note, and our first job was to get the note about mom and copy a bunch of information like manually. And I just thought to myself, boy, there's got to be a better way. And so it was really fulfilling for me, as I joined faculty and helped with our first electronic health record implementation, to help design that better way, where we pulled the electronic data from Mom's chart, made sure that we didn't have transcription errors, designed electronic orders to improve quality and safety. And so for me, the perspective that I bring is a patient-centered and quality-centered perspective, where everything that we do from an information services standpoint should be about improving the quality of care that we deliver, whether that's directly like reducing medication errors, or indirectly by improving the patient experience, the digital front portal, or improving the experience of some of our staff members, in revenue cycle and finance and elsewhere. So there's a lot of different, I think, perspectives that add value. One of the things, though, that you highlighted, Mark, that I'm really a big believer in is just constant quality improvement. I mean, our organizational mantra around Lean is that we want our 10,000 employees to be 10,000 problem solvers, right? And if you're always thinking about how you can improve processes, your organization will benefit as a whole. And so, if you look to other industries, outside of healthcare, for example, the CIO at Wells Fargo also oversees the process engineering and improvement teams. Very few departmental leaders have that focus on processes that the CIO has. And so I think that does create opportunities to think about stretching outside of leading, just information services, right? And so this is something that you've touched on as we see, new and different titles in the organization, from chief digital officer to chief innovation officer and others. I think there is opportunity for CIOs to take on additional roles and scope where they can add value and drive change, not just as an area that's aligning with the organization's goals, but as responsible for an area that's driving the organization's goals. So for me personally, as I assume the quality and patient safety leadership role, we set goals around our Vizient ranking, which is quality scores around academic medical centers. And we felt that was the best reflection of our true north, which is to deliver truly high reliability care throughout the organization. And so as we started doubling down on how we're going to accomplish those goals, there were a lot of information services, processes, and systems that we could really deploy and leverage at a greater depth than we had previously, partly because, I was accountable for this operational goal now. So I think we'll see more and more of that moving forward, where the CIO may not just be leading information technology, but also other areas of the business.
Right.
And that actually segues into my next question. So you were partly psychic and partly just discussing appropriately. And so my next question was going to be, as these new roles come online, CIOs are often either supervising those individuals or at least collaborating with them and interacting very extensively. So we have titles now like Chief Digital Officer, Chief Analytics Officer, Chief Innovation Officer, Chief Patient Experience Officer, Chief Transformation Officer. I've heard some even really creative ones. What is it that we should understand about what CIOs should be doing in relation to those people, regardless of whether they become their managers or not? In many cases, we're having people emerge with these new roles and positions, and they're not being supervised by the CIO, but the CIO certainly must be connected to them.
Yeah.
I'll take that one first, if I may. I mean,
Yeah.
I think you're going to continue to see this evolve in terms of the roles and expanded roles. I think it's going to vary organization to organization, and it's going to depend on the size of the organization. I think there was a lot of new positions added in individuals at the chief level over the last several years. I think that the trend in the past year is that I'm seeing more CIOs with expanded titles. Yeah. Chief Information and Digital, Chief Information Analytic, Chief Information and Innovation. And I think that's a combination of organizations looking at, do we really need to add another person, or is that the role of the CIO? Is that person ready for it? Does that person want it? There could be a cost factor. How many chiefs are we going to be paying at this point in time with finances what they are? So I think it's really going to vary, and we're going to continue to see that evolution. And there's that space in terms of those new roles, and then there's CIOs taking on more operational roles as organizations may restructure. They view the CIO as one more senior level person who can expand their portfolio and take maybe some operational areas as well. So, it's going to be organization to organization, but it's exciting to see as CIOs grow into those broader roles.
Yeah, and I want everyone to leap in, but Tim Zoff, I want to ask you, because you've been in a combined role, and how does this feel to you?
Yeah, I think it's really interesting. I actually think that I've always been waiting for the acknowledgement, given the visibility that a CIO has to the organization, how they apply technology and change. I think it's been a natural evolution that they would want leaders to do more because they have a skill set that spans the organization, right? And they've been doing change across the organization. Right. But I also say sometimes it's less about what they call you and more about how you engage. Right. And it's really important that you be now, the technology is a team sport, and how you engage others and how you actually engage not only, but also empower others will be really a hallmark of, I think, of your leadership style going forward. But I would make one point on this, and maybe, my colleagues can talk about this, but what's really important for CIOs now is to think about how they create their capacity for leadership. And their capacity for leadership comes from one, foundations of operational excellence. As one of my colleagues says, be brilliant at the basics, make sure the trains run on time, right? Because if you don't do that, the organization won't have confidence to give you anything else, and you won't have the capacity to lead. But the second part of this, which I think is going to be a hallmark of all future leaders, is talent management. How good am I at not only recruiting, but I think the hallmark of organizations going forward is, can I reskill and upskill the people that not only work for me, but within the organization? So creating this capacity for leadership, we've had this wonderful opportunity to grow our skills and learn the organization from the inside. Our visibility into healthcare, and Chris has got it now because he's got it not only from the provider side, but now also from the CIO side. We've got great visibility, but it's going to be up to us as CIO leaders to really create the foundations, the capacity, so that when people knock on the door and say, do I hire now somebody else, or can I give this role to you, that you have the confidence and the capacity to lead.
Absolutely. Now, I want to ask Chris Longhurst, especially, and Sue, but of course, everyone can leap in. The CMIO role, and Chris, of course, you lived it, is so incredibly important now. How should CIOs and CMIOs interact? To me, what's fascinating is, as we move forward along dimensions around clinical transformation, the CMIO becomes so incredibly important. So what does that, and I know the relationship will look different in every organization, and I can read Sue's mind and tell that she's thinking about saying that. But in a very broad way, what should that landscape kind of look like between the CIO and CMIO? Chris Longhurst, and then everyone.
Sure. Well, I want to connect this to the previous discussion and something Tim said, which is that, part of our responsibility as senior leaders and members of the executive team is to develop high functioning teams, right? And part of what my boss, the CEO, did when she placed me in the quality and patient safety role is she showed confidence in the team that I had developed within information services, that they didn't need the day-to-day micromanagement kind of leadership. And that's really a huge credit to our Chief Technology Officer, John Torello, our applications leader, Josh Glandorf, and others. And similarly, I look at other physician CIOs like Dr. Ashish Atreja, who's new at UC Davis, and he carries that title now of Chief Information and Digital Officer. And part of the reason that the organization was able to put him in that role was because John Cook, who had served as interim CIO, has such a strong handle on the day-to-day operations of information technology. And so now looking forward, Mark, to your question about, chief medical information officers, I think that the CMIOs are clearly, undergoing an evolution as well. In the 90s, we saw kind of version 1.0, and Betsy Hersher helped to describe that, but it was often sort of the physician geek, the doctor who wanted to play with the technology. And I think in the 2000s, as the Institute of Medicine report really focused on the opportunity for IT and CPOE and EMRs to improve quality and safety, you saw sort of the second version of that leader who was really focused more on business outcomes and improving quality and safety more than the technology itself. As I look at our team here at UC San Diego Health, one of the smartest things that I did was not try to play the CMIO role myself when I came here. I think they are very distinct roles. The CIO has very different scope of responsibility, budget, business systems, and other things. And in fact, I inherited a terrific CMIO, Dr. Brian Clay, who has a hospital medicine background and really doing wonderful things on the inpatient side. At the same time, we had some gaps in our ambulatory space. And so I appointed an ambulatory CMIO, somebody who is a very well-respected clinician, Dr. Marlene Millen, and she's just been doing a terrific job of focusing on things like EHR optimization, but also physician experience and improving the physician, time with the EHR, leading initiatives like our Sprint initiative to optimize after-hours charting. And then we have a trio of CMIOs because we also interviewed for and appointed Dr. Amy Siddipati in a CMIO for population health role. And so Amy works closely with our Pop Health group, who oversees accountable care organization of 35,000 patients. She does a lot of bulk ordering and bulk analytics and population health initiatives like remote patient monitoring. And the three of them work very well together. But very similar to the last discussion about taking on expanded capabilities and opportunities, Dr. Brian Clay was also recently appointed as the Associate CMO for Inpatient Operations. So he's the CMIO for inpatient care and really kind of owns our electronic health records and technology processes inpatient. And now he also owns some of the inpatient operations from an associate chief medical officer standpoint. And that's just, from my perspective, terrific alignment, provides a career growth path, and ensures that we're really well aligned on operational initiatives. And so, I expect to see more of that type of blurring of the lines. There's always been this kind of discussion about should the CMIOs report through the chief medical officer or through the chief information officer, and the answer is both, especially in highly matrixed academic medical center environments. So Sue, I'd look forward to hearing from you. I know Dr. Marv Harper well at Boston Kids, and I'm sure he's a great partner.
Yeah, he is, absolutely. So he's on my team. We have a CNIO as well at Boston Children's, Lee Williams. She reports up to the CNO. And I'd like to comment more on the CNIO. I think Chris did a great job on the CMIO. A lot less organizations have CNIOs, and a lot more organizations should have CNIOs. Talking to people, it was before the pandemic. I think there was some concern with some of the CNIOs that I know and that are on our team at Starbridge Advisors that CNIOs were viewed as valuable and a role needed during major EHR implementations, and then when it's done, don't necessarily need them. I think that's a mistake. Other organizations realizing it's a more strategic role from an informatics perspective with nursing, and they need them. In fact, we are probably going to be working with an academic medical center where the CIO thinks a CNIO position is needed and is pitching it, trying to get it sold within the organization, working with his partner, the CNO. We're going to go in and we're going to help them, define what's the role. Are they ready for it? What would it look like? I just can't say enough about the importance of nursing informatics along with physician informatics as part of broad clinical informatics. And we need that nursing lens as well in CNIO roles and organizations.
Yeah. Mark, if I could just jump in, this is
Sure,
Tim.
sure.
I'm going to make a strong appeal here. It's almost to the industry. I think this notion of informatics, that is people that live at that intersection of technology and particularly technology and care, we need them now more than ever. I really, if you look back on the last decade, if you look at what technology has really done, it's enabled a lot of things, but it's really in many ways taken away from the practice of medicine, the way physicians and nurses want to care for patients. We spend far too much time interacting with the technology. And so we need a reinvigoration around a heightened sensitivity that technology really works for providers. And I think informatics has got to be elevated in order for that to happen. That voice has got to be clear in everything that we do. And frankly, this last year that we've gone through, and Chris and others can talk about this, we owe it to our providers and caregivers to really make sure now everything we do, every time we touch that provision of care, that we're doing it in a way that has a far greater sensitivity to the impact and the consequences of it. And informatics is one way in which that informatics voice and skill is one way that we get at really ensuring that, in fact, the technology is going to work better this next decade than it did the last decade.
I absolutely agree, Tim. And I'm about to segue to a technology-focused question. But first, David Logan, I just wanted to give you the chance, because our conversation has been kind of whipping by quickly. Any thoughts on some of the things that we've just been talking about?
Yeah, I think reflecting on the organizational design, the mission of the CIO, and then all of the related parts of the organization that touch information, touch digital systems is incredibly important. As a technologist who bridges between industries and the solutions that are provided, one of the points that I frequently make and have frequently made in the past 10 years is it's important to consider how much technology is coming into an organization and is being used that is now no longer under the direct control of what was formerly the IT organization's responsibility. This lack of this diffusion of control, related to my point earlier about we're all now responsible for the experiences that we want in these organizations. I mean, it used to be that IT and biomedical engineering really had all budgetary control for the tech that came into a healthcare organization. Now it's every department, radiology, oncology, cardiology, whatever is necessary for their particular healthcare delivery requirement to be asserted, they're going to have a say, if not the entire budget, for what's brought in. And so it's really important for the CIO to communicate to the rest of the C-suite that the IT spend of the organization has dramatically increased, but the actual IT budget has probably not. It might have even shrunk a bit. And so there's a reconciliation that needs to be made at the CIO's desk to, again, partner, bridge, and then form architectures and solutions that can embrace all of these different systems, all of these different constituencies that come in. And so when I'm in CIO conversations, I'm coaching about how does the architecture you're selecting, or how does the systems that you're putting into place last for 10 years and be integral with the other systems that you don't even know about yet. And so that's really how I coach on keeping pace.
Great point. And I'll just note that we've kind of gone through different waves where things were very diffuse and decentralized, and then people tried to centralize, and now it sounds like some things are getting a little diffuse again.
And that healthcare remote patient monitoring, that by itself is that's a sea change of now how we have to do things at a technology and architecture level. And it can be done, but we just have to choose to do that.
Absolutely. Absolutely. So let me zip ahead here, because I have a question for Chris Gervais about IT infrastructure related to the broader enterprise, platform and API economics and capabilities. How do CIOs think about that? Because as we all know, we're moving away from the most hardware focused elements in healthcare now. And we're kind of entering this new universe that feels very Star Trekky to some of us, in terms of, wow, there are going to be these APIs and they're kind of going to be floating around, and how do we even manage what we do about them? Chris Gervais, any thoughts?
Sure. It actually ties, I think, back to some of the comments that were just being made. When you think about some of these other roles that are so critical for the CIO to not just collaborate with, but know how to harness as either the solution space in the enterprise is more diffuse, right? And you want to make sure that the solutions you're part of building, and that you want to bring into all these different modalities, right? Some cases right into the home are clinically validated, right? Have that strong sort of clinical workflow and backing, so the data coming in and the workflow coming in is correct. Because I think the platform economy now is making it easier to make some of these more rapid choices, right? Where I could stand up things quicker. I can, it doesn't always work this simply, but I can sort of hopefully plug this thing into here and get this data flowing, especially with the mandates coming and, a lot of the rules around information blocking and the acceptance of FHIR and other types of solutions that it should allow not just more interoperability, but more compositional types of solutions that could be quickly brought together. That sort of notion of platform and portfolio thinking, I think, is really going to have to pervade in a new way, right? Because some of the most expensive real estate that a healthcare enterprise has is its data center, right? It's also some of the most risky. And as you think about the ability now to say, I've got a core set of solutions, they can span time and space and beyond space that I own and beyond people, that are on my staff. It becomes more of a, what are my points of leverage? How can I exercise them along with the things that I do have, right? Running under my own air-conditioned, raised floor section. But again, giving not just myself and my teams, but the teams around me new ways to engage and interact, and to bring solutions to market. And to the point that was brought up earlier, I think by Chris, around some of that lean approach, which is also built on fast iteration, not just to go fast, but to learn as quickly as possible, right? To make mistakes as quickly as possible, but to do them in a way where the blast radius is really well contained, right? So you can, oops, that hurt a little bit, great. Let's not go that way, but I'm gonna just adjust 5 degrees, and it's not gonna take me another turn of the Gantt chart with the waterfall. It's because we're gonna address it in tomorrow's stand-up, right? And we can move. And so it's again, the technology and the platform thinking is one aspect. It's coupled with that ability to innovate on process, and I think innovate on the relationships in the enterprise that will really allow CIOs to harness it and then bring that value back to that C-suite, right? As was articulated around those business problems, the economic output, the clinical impact, but also the patient impact, right? And again, us figuring out how do we, for these large health systems, how are we going to meet the patients where they're at and what they're comfortable with, but with the clinical integrity, the workflow integrity, the data integrity that we need. So it's a lot of new capability that definitely is scary, but boy, is it exciting.
Yeah, great point. Thank you so much, Chris. So how did I know this would happen? We have brilliant people here, even talking fast. We're almost at the end. So what I'm going to have to do is, we could talk for another 2 hours, but I'm going to actually have to ask each person to leave us with one piece of wisdom, as I often do, either a piece of advice for our viewers or a prediction for the next few years, in some way related to what we've talked about. So I'm going to go around the clock again. Sushade. Oh, you're muted.
Yeah, there was a truck on the street and I thought, okay, mute. Piece of advice for the next few years. I've always been passionate about working in healthcare, and that passion continues. I think that the past year has been hard. It has been hard for people. I think we're going to see people leaving the industry as time goes on, maybe earlier than they had planned to, or retiring earlier than they planned to. I think we have to embrace the future. We have to embrace the new. We have to embrace what's evolving, and we have to continually look to develop the next generation of leaders. You've got a lot of experience here, and we've got a lot of new people coming up. And back to when Tim talked about the importance of talent management, I can't emphasize that enough. We've got people coming behind all of us that we need to be nurturing and developing.
Absolutely. Chris Longhurst.
Thanks, Mark. I echo Sue's comments. I think that there's a whole generation of CIOs retiring, as Starbridge Advisors knows, And as the next generation assumes some of these leadership roles, it's really critical that we're building the high functioning teams, that we're developing the people around us, and that we're keeping our eyes on the goals of the organization, right? How is what you're doing aligning with and contributing to the organizational goals to provide high quality, highly reliable healthcare to our patients that we serve, to ensure that you're sustaining the mission, and to make sure that we're optimizing kind of new opportunities for patient experience. And so I think each of us has roles to play in that. And whether you're on the infrastructure side or the application side or the analytics and informatics teams, there's so much that we can offer these organizations that historically, we perhaps have not been fulfilling to our full capacity. So it's really a great time in this industry, and I'm excited to be in it and look forward to seeing you all in person, hopefully sometime soon.
Absolutely, absolutely. Tim's off.
Yeah, I know. I just echo my colleagues. I just say, step into the moment. This is an amazing time in healthcare. Lean in, don't lean back. And really work to give confidence in your leadership team to be more ambitious with technology now. This is a great time to, take a bit of risk and really step forward with what technology can do. And then the third point, we've talked about this before, but take others with you. I think the hallmark of leaders is really their ability to develop other leaders and their teams. So it's really important that you recognize that you've got a critical role here in really harnessing that next generation of leadership and talent as well.
Wonderful. I agree. Thank you. David Logan.
Thanks. It's been a real pleasure to listen to everybody today. So Mark, thank you for that. I'll make one quick reflection. The past year and a half has clearly shown us that we can dispel myths. It's tested plans, it's tested systems, it's tested organizations. And we need to take the lessons learned and go back and reevaluate assumptions that we might have made, and then use that to move forward over the next 1 to 2 years. Over the next 10 years, I'll leave our audience with: get ready for another order of magnitude of increase in the number of devices and applications and systems that will be in use, and think about how that translates into what that means into your overall enterprise architecture and your CIO, CTO strategy, and especially about the team, because the team that will come together over the next 10 years to manage these transitions, where we have fully instrumented healthcare delivery, so to speak, at great distances, is going to be different than last year and 10 years ago. So,
thanks. Perfect. Chris Gervais.
Well, again, I think a common thread through everyone's comments, and it's certainly one of mine, is that change is constant. It's something that we not just have to live with, but continue to embrace. And while I think the last year, and I know the last year has been very hard, I think everyone has to make sure that you can find that bit of headspace to step out for a few moments in order to gain some new perspective, new energy, and also just new ways to harness those around you, because I think everyone's been on a journey through the last year, personal, professional, otherwise. And what will happen next, none of us know, but it's how we're going to be prepared for that, to approach that situation. And I think there's so much learned from this year, and I hope it doesn't resolve to just return to normal, because this is a great time to innovate through that and create an entirely new, department or approach or group or strategy that really is innovating for that next 10 years, and to get to that shift that, that next shift that David's talked about. It's not going to happen 10 years from now. It's probably going to happen in 18 months. So get ready.
Absolutely. Thank you, Chris. You've all left us with such brilliant comments. Really, I agree with everything that's been said. I'm going to leave you with a thought and a quote. So the thought is burning platform. We are going, as the Medicare actuaries have noted, from the current 3.6 trillion-ish a year in annual healthcare expenditures in this country to 6 trillion in the next 5 to 6 years, which is mind-blowing. Anyone whose mind is not blown isn't really aware. That's the great burning platform for us for clinical transformation, operational transformation, improved outcomes, and everything. And I'll leave you with a quote. 2,000 years ago, the great Roman orator and senator Seneca said, those willing to change, the fates guide; those unwilling, the fates drag. I certainly hope that no one will be dragged, because it's actually quite painful. And I so appreciate our panelists who are never going to be dragged, because they're always innovating. And we really appreciate your wisdom today. And on that note, Stephen has magically reappeared.
I'm back. I just pop up in various spots. All right. Thank you, everybody. That was a wonderful conversation. Sue, Chris, David, Chris, a wonderful, wonderful, wonderful. Tim, you guys perfectly teed up our last panel of the day, which is happening at 3 o'clock. And we're going to be talking about IT leadership. And so thank you for unknowingly teeing that up a little bit. We appreciate it. So, but before that, after our hour lunch break, we've got our next session at 2 p.m., which is all about how open source technology is being used in healthcare. So I encourage you all to join us back here at 2 p.m. for that session. It's another great one. And like I said, we have our IT leadership closing panel at 3 o'clock Eastern today. And you'll be getting reminders about those. Of course, thank you to our two sponsors of this session, Ruba and Kairos. We really appreciate it. You guys have a wonderful afternoon, and we'll see you right back here at 2 o'clock. Take care.
Thank you all.
Bye, everybody.
Thank you.
Thank you.